Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today, we welcome back Tod Stillson. He's a family physician. His KevinMD article is titled, "It's Time for Every Doctor to Start a Professional Micro Corporation." Tod, welcome back to the show.
Kevin, it's great to be back with you and to share a little bit about my blog with you.
Perfect. So I think I was just looking back. We're talking offline. We last spoke more than 2 years ago.
Yes,
And how have you been since then?
I've been doing fantastic. I'm in the wind down of my 30 years of clinical practice. So I'm within less than a year of being done, being a clinician in my little community in Northern Indiana.
All right. What do you have planned next?
I'm going to do some locums. I'm going to continue to do some writing and blogging and follow some passions that include helping doctors become micro corporations.
All right. So what's your practice like now?
So right now I'm a general family doctor who does OB, pediatrics, hospital care, kind of the whole thing in rural
Wow.
medicine. I also precept students and residents and really have a great thriving practice of about 5,000 patients.
So what you described is kind of a dying breed. So you do it
Yeah,
all. You do the OB,
that
you
is
do the
true. Yes.
hospital, you do in the office. So
Yes.
tell me about the challenges of that and what's your feelings about that form of physician just kind of becoming less and less common?
Yeah, it's sad truth that it is becoming less and less common, and I used to resist it a bit more, but now I understand more kind of as the young physicians are coming in, kind of what their preferences are for a lifestyle and really the quality of life they want to have in their professional life. So I also see a lot of just hospital changes. For instance, the hospital that I'm working at is in the process of closing their OB unit in our Little Roar Hospital, which is a pretty big deal. It's going to have to push people out to deliver babies about 45 minutes from where we live. But it's all part of the economic climate of hospitals and the work they're doing. And so it's just changes evolve. And frankly, all doctors have to adapt to things.
Yeah. So you are indeed a true family physician doing it all. So what do you see as the future of family medicine as those parts of medicine, whether it's the hospital, the clinic, OB, becomes more specialized?
Yeah, I see family physicians, of course, still being on the front lines out doing primary care in community based areas, but they're also going to become kind of captains of teams. So there's a lot of ancillary staff members, whether it be a social worker, a pharmacist, nurses, nurse practitioners, and the family doctors of the future are going to have to be good quarterbacks in terms of not just managing patients clinically, but really in some regards influencing and affecting a whole group of providers that work to take care of patients together.
How do you feel about that?
I think in the right setting, it can work well, but I think the downside to that is that sometimes doctors are minimized in terms of their professional status. They become, quote, providers that are just one of the other providers in the stable and are seen as commodities by the companies that employ them. And therefore, it can be kind of, I guess, painful for doctors to begin to see themselves just as simple commodities. So I think we need to continue to adapt as a profession into a professional status and use our brains and skills to maximize all that we can provide to the economy.
All right. So in your Kevin MD article, you talk about the concept of a micro corporation. Your article's titled, "It's Time for Every Doctor to Start a Professional Micro Corporation." So talk about your article. Maybe you can start with defining what exactly is a micro corporation.
Yeah, so the corporation is really a corporation that's designed to envelop you as an individual physician. It's really that simple. And as a professional, we've all earned the right as doctors just by going through our training to organize ourselves in that way. There are other professions that have that same opportunity, lawyers, accountants, engineers, and the like. They all have that ability to be a professional corporation as an individual. About 40, 50 years ago, doctors kind of used that envelope in a different way that went into private practice. That kind of became the idea of like a professional corporation included a building and included having employees. It included really doing a whole lot of medical care in a community-based setting. And a micro corporation is really just about you. You're not managing anybody except the one single employee you have, which is yourself. And then you're using that micro corporation in all the professional environments that you can imagine for any job in the country. So in some regards, Kevin, doctors can look at themselves as individuals, like individual taxpayers, like a W-2 taxpayer, or they can look at themselves as individual micro corporations and engage in professional service contracts with anybody that wants to work with them, either as an individual or as a corporation.
So tell us, what would that look like in practice? And given the fact that a lot of physicians, like you said, are working in W-2 situations, they're employees somewhere. So what would a physician representing himself or herself as a micro corporation look like in a common scenario like that?
Yeah, that's a great question. And this is a little bit of a hidden gem for doctors that they don't know there's something called employment light. Employment light is basically where you contract with the hospital and in many cases who want to employ you. And rather than being a business, the hospital to individual contract, it's a business to business relationship. So their business to your business. It's really all the other guts of the contract are all the same, but who they're paying is not you individually. They're paying your micro corporation. So that's through a 1099 contract, which provides you both autonomy professionally, but also a whole bunch of small business tax benefits. To the hospital, they're paying you for those services. It really doesn't matter who they're paying. They're getting the same sort of management and control of you. But in many regards, you gain a whole lot on the other side when you receive it as a micro corporation rather than an individual. And so those options exist all across the country. It's called employment light. Virtually every major hospital employee that employs doctors have employment light in their menu. But Kevin, I like to call it the hidden menu. When I go to Dairy Queen, I look at the menu on the panel and I see all the stuff I can get. But there's things that you can order on the menu at Dairy Queen that are not on that panel. You may or may not know that. And the same is true for doctors when they go to contract with hospitals to do the work. The hospital is not going to tell them the whole menu of options. They're going to provide them the menu of options, which is really what I call traditional employment. They're going to be their primary go-to mode. This is status quo. But you have to know that there are other options for forming that contract with them. And that includes employment light through a micro corporation.
Tell us some of those benefits. You mentioned tax benefits, financial benefits,
Yeah.
getting paid as a 1099. Just go into more detail exactly
Yeah.
what those are.
So I think that there are really two big elements that I consider important. And this is part of my personal journey. My first 15 years in practice, I was just this traditional employee. And frankly, it led me towards the path of burnout, which a lot of doctors have experienced and know all about this. I happen to believe employment, traditional employment in particular, is one of the major drivers of that for a number of reasons that you've had on your podcast before. It wasn't until about 10 to 15 years ago that I discovered this other option, this I could incorporate option and still continue to be employed by the same employer, but in a different business to business relationship. Once I discovered that and began to take control of my life and take control of my professional life, it changed everything because all of a sudden control and autonomy was restored to me. That's one of the most fundamental things that every doctor you talk to probably will talk about. They want to have control over their professional life. And when you enter into a relationship with an employer, if it's as a traditional employee, by definition, that means they control you. If you enter into it as a business to business relationship, they don't control you. They control how the organization of that business relationship is, but they don't control you. Your business controls you. So autonomy is one fundamental element. The other element that high income earners like doctors have to deal with are taxes, right? It's a very common conversation. And so, again, doctors lose sight of the fact that as a W-2, and especially a high income earning W-2, you have very little play when it comes to your taxes and how to mitigate them. Yeah. There's a few small options. But when you organize yourself as a small business and you have both channels, small business and individual channels, i.e. 1099 income, then all of a sudden your tax options to move and really retain some of your income go up dramatically, along with your ability to enhance your retirement savings go up dramatically, So there's a bunch of small business tax plays that are interplayed in this. So I would say those are two of the most fundamental elements of that transition, both autonomy and tax strategies.
As you know, the difference between getting paid 1099 versus W-2, of course, is benefits. How does that affect the benefit situation
Yes,
if
yeah.
you're a micro corporation?
So a lot of physicians fear that whole benefit thing because of the 1099 physician, you have to go acquire your own benefits. So whether it be your health insurance, your life insurance, your malpractice insurance, et cetera, you go and obtain those. It's really not that difficult. And there are a lot of agencies that will help physicians do this. I like it because it allows for an individualized benefit plan. When you are an employee, you have a generic benefit plan. When you are a 1099 physician and have your own corporation, you get to individualize that benefit plan and fringe benefits that you have. So you don't get any extras that you don't need. You're really just going to pay for what you do need. And that's a wide range of those benefit plans. Some of the benefits will depend how they can be incorporated in a tax efficient manner will depend on whether you decide to be an S Corp or a C Corp. That's some micro information about it, but there's different benefits that will apply to each of those different corporations in a micro corporation. But I love it because, and the other physicians should not fear getting those benefits. They should actually enjoy the process of individualizing those benefit plans.
So, what is the first step of incorporating? Is it, getting an LLC? Is it formally incorporating? So, if someone was
Yeah.
interested in pursuing this, tell us the first steps and walk us through the next few.
Yeah. So first of all, you have to be a licensed physician in a state. And so kind of pull back a little bit here. And I want every physician to know that when you go through your training process, you've earned the right to actually incorporate. And so that includes getting your license. And a lot of physicians, as they wrap up their training and residency or fellowship, they go through the process of providing all those credentials. And most common approach they'll take is to get board certification in their specialty. That's a step you do to certify to the world that you are board certified. I would say a similar step they should consider doing once they have their license and once they have all the proof that they are a licensed physician is to go ahead and form a micro corporation around themselves, just like they would go about the process of becoming board certified. The way you do that is you do that through an individual state. And typically you would do that through legal counsel that would help you identify which type of corporation will work best for you. Two most common are typically a professional corporation or a C, or a PC it's called, or a professional LLC, a PLLC. Both of those are pretty equitable. It depends on the state you're in. One might be a little bit more favorable than the other. So PC or PLLC are really your best options. Some doctors do form a individual LLC that's taxed as an individual taxpayer. Some doctors choose to be sole proprietors, again, taxed as an individual. But I really advocate for doctors to incorporate themselves as PCs or PLLCs for a number of liability reasons as well as a number of tax reasons.
Now, when you're entering a contract negotiation with the hospital as a micro corporation, how common is that? And how would you approach the hospital saying that you want to negotiate as a micro corporation?
Yeah, that's another very good question. And I would say it's pretty uncommon. And most hospitals are not used to a doctor coming at them and saying they want to negotiate their contract as a business relationship. The only exception to that is if you're a locums. Okay, then they're used to that a little bit more in terms of business to business relationship. Traditionally, the land of micro corporations have been dominated by locums. But really, there's a whole menu of job options that exist out there for doctors as micro corporations now that go well beyond locums. It's what I call not short-term labor. It's what I call long-term labor. And all the hospitals are looking for long-term laborers, and they traditionally have funneled that into employment, but now they can funnel that into employment light rather than traditional employment. But you have to communicate this up front. So I think a simple way to look at it is we're in a physician shortage mostly. There's a recruitment and retention issue that every hospital has with physicians. And when they begin recruiting you, you go through the dance, you figure out if this is the right place, a good match, you do all the stuff that doctors do. At the end of that process, you can definitely say, well, I'm interested in working for you, but these are the terms of how I want to work for you. I am a professional corporation, and I like my contract to be organized through it as a professional corporation rather than through an individual. Most hospitals are going to say, oh, okay, well, that's how our legal department can do this, especially if they're interested in you. I also recommend to physicians who are very assertive about this that they even let the recruiter know that up front. So if they're working with a recruiting firm, they can definitely say, look, I want to do an employment-like contract. I want to work as a long-term contractor with the hospital. And so don't profile for me hospitals that are unwilling to do that. Profile for me hospitals that are willing to do that. And so there is a profile for hospitals that are typically more willing to do it, et cetera.
Now, tell us some of the difference in contract negotiations as a micro corporation. I'm sure the salary numbers are going to be a little bit different because the benefits are going to be defined differently as a
Yeah.
micro corporation versus individual corporation. But other than that obvious factor, what are some other contrasting things that a physician should know about when negotiating as a micro corporation?
Well, the first step of if we're going to compare apples to apples, employment light to traditional employment as an example, Kevin, first of all, I would say the compensation structure built into either one of those contracts can be totally the same. In other words, apples to apples, you're not asking for more as a contractor. You're asking for just literally the same amount of money. But here's the difference. Most of those doctors who are traditionally employed, the benefit packages, the malpractice insurance, the other things that are paid for by the employer are worth about $30,000 to $50,000. And I recommend what I call a gross up process. In other words, you would ask the employer to pay that extra $30,000 to $50,000 to you rather than you just eating it yourself in terms of that contract. So they can't pay for those benefits for you, but they can give you additional compensation that covers that cost. For the employer, this makes it an apples to apples comparison. In other words, your physician labor as a employee and your physician labor cost to them as a employment light doctor is going to be exactly the same. And in fact, the nuance of that is this, Kevin, that the employment light doctor is going to cost that hospital less money. And the reason is that if you took those two stories I just said and compared them, the hospital for the employment light contractor is not going to be paying their employment taxes. It's going to save that hospital about $10,000. So actually, you're going to be the cheaper labor compared to the traditional doctor, literally getting paid exactly the same in the same compensation structure. But it's what you can do after you receive that money as a microcorporation that allows you to retain and save a whole lot more than the traditional employee.
Tell us what kind of resources a physician can turn to during that negotiation process. Do most physician contract attorneys, would they know how to negotiate on behalf of a physician microcorporation? Do you have
Yes.
to have specialized services? Because how would a physician know whether to get that upfront cost equivalent to benefits of $30,000 to $50,000 as walking? Well, tell us
Yeah.
what kind of help they would need to do that.
Yeah, that's so. First of all, you're making the point, and I think it is a good point that most doctors are business illiterate, so to speak. And so they're not sure. And unfortunately, a lot of doctors will engage in those negotiations by themselves individually without support of a team around them. And I very much encourage physicians to identify either an agency, like I have one with Simply MD that does that, or there's multiple other agencies around the country that support doctors. There's lawyers that do this, that support doctors and involving them as their representative in that engagement process and helping them to know how to best negotiate. Some doctors are confident. Unfortunately, some of them are overconfident about their ability to negotiate, and they will do a whole lot better if they have a third party helping them and assisting them in the process.
Are there any situations where a microcorporation may not be the right step for a physician?
Absolutely. I think there are situations in which traditional employment is a better option. And in those cases, I would say probably the most common scenario that I would see where that might be the case is if a physician comes out of their training with a very large burden of loans. And so as part of their negotiation with that hospital is the resolution of those loans, oftentimes at least a certain amount of it for X amount of period of service. And often that's going to be engaged or supported in a true traditional employment relationship. Since a lot of the young doctors have these large student loans, that's not uncommon. Maybe they could look at their first 3 to 5 years as being more traditional, but then after that first contract and they've paid for or resolved those things, looking at the use of a micro corporation would be definitely something to consider. I encourage doctors to do this during their residency. I encourage them to do it so that it's done up front, so that they have this in their pocket. When they go to look for their job, they can profile those hospitals that are willing to do it. And frankly, can you even use it for the side jobs they do? They can use it for moonlighting. They can use it in really all sorts of environments. Oftentimes doctors may not know this, but they can use it if they join a private practice group. So you can join a private practice group as a micro corporation. In other words, you as an individual doctor don't have to own your shares of that private practice group. Your micro corporation can own those shares of that private practice group. So really, if you think of any place that an individual doctor can go and work, their micro corporation can go and work and do the exact same thing. It's just an intermediary in the business to business relationship.
And my final question, Todd, tell us some of your take-home messages that you want to leave with the KevinMD audience.
Yeah, my take-home message is that doctors should find people whom can teach them, coach them, and mentor them in understanding the value and benefits of micro corporations. And it's important for doctors to find people who can do that. It's one of the reasons I started my agency, Simply MD, as a community of physicians to help each other mutually grow in their understanding and their competency of business knowledge that allows doctors to thrive. And it's very important for doctors to find people that can help them with this.
Todd, thank you so much for sharing your perspective, time, and insight. Thanks again for coming back on the show.
You bet, Kevin. Thank you.